Hi, everyone, and welcome to the Luminous Global Virtual Conference. My name is Kevin Mendel, and I'm the Vice President of Marketing for Luminous Aesthetic Americas. We are so thrilled that so many of you can join us today actually tune in from around the world. I was just looking at our attendees. We have folks from Europe, from India, from Israel, all over the United States, so we're really excited to have you here. Just so you know, our global virtual event kicked off yesterday and now continues through Friday, May 22nd. What I love about this event is that it features over 30 live and on-demand webcasts from across the globe and is actually divided into three educational tracks, devices and treatments, Ask Clinical, and of course, practice marketing. Just so you know, you can actually download any of our bonus materials from the audience council box that's actually in plain view and plain sight on the audience view. Typically in the top right corner, you'll be able to actually download these bonus materials. Today, of course, we have our ebook on telehealth that Dr. Lamrell actually authored. And just to give you some other information, this conference continues with many, many events today and throughout next week. Actually, our next live event begins at 11 a.m. Pacific time today with Creating the Geneo Buzz Post-COVID. We hope all of you will most certainly attend. So without further ado, I'd like to introduce our speaker. Dr. Alyssa Lamrell is a board-certified dermatologist providing high-quality medical, surgical, and cosmetic dermatology to patients throughout Massachusetts. Dr. Lamrell founded Skin Dermatology in 2018 with the sole purpose of providing a full spectrum of dermatologic care to her patients, from acne and skin cancer treatments to a full line of cosmetic services. Skin Dermatology is dedicating to creating the best patient experience while providing the highest quality care. She believes in expert-level, customized, personal boutique-style care for every patient. So at this time, I would like to introduce Dr. Alyssa Lamrell. Dr. Lamrell, the floor is yours.
Thank you very much for that introduction, Kevin. He was able to touch on a lot of high points about myself, and I just wanted to thank you for having me here today so that I could share with you my experience with telehealth. I, like he said, am a board-certified dermatologist practicing in Central Massachusetts, and in 2018, I opened a private practice there, and we had become quite successful at our practice, and we were having a tremendous start to our year until about mid-March, when that all abruptly changed as we had to discontinue in-office care and transition to a virtual care model. At that time, my staff and I had to quickly do what was necessary to add the enhancements to our electronic health record, which we were luckily provided for by our practice management suite. And that allowed us to provide an integrated telehealth solution. And since that time, we began to transition all appropriate patients and appointment types to telehealth. So what is telehealth? Telehealth is defined as the delivery and facilitation of health and health-related services, including medical care, provider and patient education, health information services, and self-care via telecommunications and digital communication technologies. The ability to offer patients vital healthcare services via video conferencing or other remote technologies increases patient access to healthcare. Providers, in turn, can utilize this tool to engage new patients and to continue to care for pre-existing patients. This enables providers to expand their offerings and continue patient engagement in times like these or as an adjunct to traditional face-to-face encounters. The recent COVID-19 pandemic has resulted in a surge in telehealth interest from providers who want to continue to engage patients, all while maintaining adherence to stay-at-home ordinances that help to protect those involved with the distribution of non-emergent healthcare. Being able to utilize this tool during the widespread practice closures due to COVID-19 has been an enhancement to our practice of medicine and has allowed practices such as mine to continue to care for patients virtually. Providers of multiple specialties and aesthetic practitioners are well suited for integrating telehealth. In this webinar, I've teamed with Luminous to share my own experiences and success with implementing telehealth. My hope is that we can continue to share the valuable lessons and insight learned during this pandemic to help use telehealth as a complementary way to continue our practice of medicine going forward. So the terms telehealth and telemedicine are often used interchangeably, but there are some distinctions that we should pay attention to. So telehealth actually refers to the umbrella of the range of services and technologies used to deliver healthcare efficiently and effectively. Telehealth encompasses the non-clinical services such as provider training, administrative meetings, and continuing medical education, in addition to clinical services that are provided to clients or patients. Telemedicine is the portion of telehealth that refers to the actual clinical encounter. This involves consulting with a patient or client through a telecommunication platform and providing medical decision-making without needing to have an inpatient encounter. In my practice, we use the term telehealth as it has evolved to encapsulate a broader array of digital healthcare activities and services. Telehealth has opened doors for both providers and patients alike, allowing patients to be evaluated remotely with the assistance of digital technology. During this pandemic, private insurers and the Centers for Medicare and Medicaid have identified multiple ways in which a telehealth visit can be performed and compensated for. Accordingly, coding, billing, and compensation are determined by the type of encounter that is made. So there are a few types of encounters that have been defined, and I will go over those now. So the first is called the synchronous visit. In my mind, this type of visit most mimics an in-person patient encounter, but instead of meeting face-to-face with your patients in your office, you are meeting your patient face-to-face through a video streaming platform. I perform synchronous encounters in the same fashion I would in terms of breadth and scope as I would if a patient were sitting across from me in my exam room. I utilize my electronic health record to document, code, and bill in a similar fashion as well. And if needed, I have one of my staff listen to scribe for me during this call, as I would in my office. The second type is called the asynchronous visit. This is more of a store and forward technology, which in my world of dermatology means that a photo is sent for me to review through a HIPAA-compliant email or secure patient portal. The provider then will respond electronically back to the patient without the need for a face-to-face encounter. This encounter is documented and billed according to the current telehealth CPT codes that have been defined. Lastly, the last type of encounter that we'll talk about is a telephone or other electronic media type of encounter. Now, this type of encounter can be initiated by several different people. It could be initiated by a patient, a guardian, a consulting or referring practitioner, through a phone call, through an email, or even directly through their electronic health record if you're able to communicate with another provider that way. And then the provider will render medical advice to the attendee, and this is a time-based charge based on your medical consultation and review of the case. So dermatology and aesthetic practitioners are well suited for integrating telehealth, I have found. This modality allows me to view, diagnose, and develop treatment plans for many skin conditions remotely based on high-resolution digital images and videos provided either synchronously or asynchronously. Having multiple modalities available to communicate with my patients allows me to meet patients at their comfort level with technology and to help remove barriers that a patient may encounter to receiving this type of care. So what have we found in the short term in terms of telehealth and COVID-19? So telehealth is a communication with our patients that, again, has allowed our practice to social distance and remain closed during our state's non-essential business closure order. Telehealth has allowed my staff and I to care for patients all while working remotely. This is certainly a great tool, and I have found that we have been able to lay a foundation for future events that may necessitate shifting the way we practice medicine or provide care. This is definitely a means by which we can continue to care for our patients. During this time, by limiting in-office exposure to patients, vendors, delivery people, and the like for the past 2 months, we have been able to do our part to help flatten the curve. By limiting in-person contact and continuing to social distance through telehealth, we will help limit the spread of this or future viruses, which in turn will help to keep everyone safe and ultimately limit the burden on the healthcare system. By completing in-office encounters when appropriate to do so, we will, but when we do not have to, we will certainly help protect the supply of personal protective equipment and allow more to be available for the frontline workers. As we prepare to reopen our doors over the coming weeks, we will continue to use telehealth as a tool to address concerns that can be seen and managed efficiently with a telehealth platform. So what are our long-term benefits? With telehealth, providers can continue to care for patients in person while still providing the flexibility and convenience of seeing patients remotely for new concerns, cosmetic consultations, and follow-up visits. In my practice, I have found that many skin concerns are well suited for telehealth visits. This solution is one we view not only as a weapon in the fight against COVID-19, but a valuable tool for patients moving forward. Telemedicine offers our patients several advantages. Number one, it's convenient. They can have their appointment done in a location that is convenient to them. This helps enhance the ability to provide face-to-face medicine. This can help to significantly decrease waiting time for appointments because you could schedule these appointments maybe in different time slots, after hours, or even put them in a slot where somebody canceled in a short time frame. This can give increased access to care because you can reach a larger geography of patients because now patients don't have to travel all the way to your office if they live 1 to 2 hours away. This will also decrease waiting room time and the time just associated with coming to the doctor. And this will also help provide continuity of care. I can think in particular of my college students that go away within our state, but often have trouble coming back to see me for their follow-up visits because they are not free Monday through Friday. So this, again, can be helpful in multiple scenarios. This type of technology is secure. Our platform is 100% HIPAA compliant, which helps to protect our patients' privacy. It's safe for you because, again, it doesn't bring you into our office where potentially you could be exposed to a new illness or you could expose our staff to a new illness. And it's simple. All you really need is a smartphone, a computer, a tablet, or a device with a camera and high-speed internet connection, which most people these days have. We have seen a noticeable improvement in patient engagement and satisfaction over the past 2 months with their use of telehealth. The feedback we have received from patients of all ages has been extremely positive. When we originally rolled it out, we thought this would be an ideal platform for our millennial patients. But since, we are seeing patients of all demographics getting excited about this new technology. We designed a modern and inviting office environment in a convenient location so that our patients found themselves in a completely trustworthy and relaxed setting where they could be ensured their experience was always our #1 priority. In spite of that, there still can be apprehension about a medical visit and seeing a healthcare provider, especially when they're wearing a white coat. Telehealth, I found, allows patients to be in a space chosen by them, which seems to allow them to open up more willingly. And ultimately, this has really been eye-opening to me because it's made visits that sometimes can be challenging, again, in the office, be more relaxed and comfortable when it's chosen at a location that is comfortable to the patient. For skin dermatology, telehealth is something that we believe is a valuable service for patients of all ages moving forward. It is exciting that this platform has become widely available and is now being promoted by healthcare organizations as a way that their covered lives can seek medical care. So what are the long-term benefits to physicians? For over 40 years, telehealth has been used to bring healthcare services to patients in distant locations, but it may not have been completely in the mainstream. Not only does this improve access for patients, but it also allows physicians and practices to expand their reach beyond their own offices. Given the provider shortages throughout the world in both rural and urban areas, telehealth has a unique capacity to increase the services you can provide to thousands of new patients. In addition, virtual consults and visits allow physicians to work more efficiently and help reduce appointment no-shows by taking obstacles to getting to an appointment out of the way. Telehealth is faster, safer, and we believe more effective for some issues, and less expensive to practices in the long run, which will ultimately increase revenue and reduce overhead. So what can you do with telehealth? There's many things that you can do with telehealth. In dermatology and aesthetics, we are well suited, like I said, for integrating telehealth. This modality allows for prompt diagnoses and development of treatment plans for many skin conditions remotely based on high-resolution digital images and videos provided, like I said, synchronously or asynchronously. Telehealth allows you to enhance the world-class care that you already provide. And for specialties such as mine that are highly visual, telehealth is a perfect way for me to evaluate and care for patients, be it their medical, cosmetic, or skincare concerns. You can see patients of all ages. Just ensure you receive the proper consent and follow your practice policies that you have already outlined. So in terms of the medical evaluation, in my practice, we offer telehealth visits for many medical conditions, like I said, from all ages, from infants to the elderly. We provide routine dermatologic care for acute and chronic skin conditions, and we provide evaluations for new problems, such as a concerning skin lesion. We do require that patients send us a high-definition photo at least 24 hours prior to the visit so that I can review it. I want to ensure that the condition of concern is suited for telehealth and not something that I actually really do need to see the patient in person at the office for. What I would like to let you know that is that not everything is suitable for telehealth. There still will be the many types of appointments in all of our specialties that will require in-person care. And in dermatology, the types of appointments that I've identified that will not work for me to be conducting via telehealth are skin cancer screenings, because this takes more of a thorough approach in having to be able to look over every square inch of someone's body. And it would be hard to photograph that or even video an entire body. Skin cancer is the most common type of cancer in the United States, and early detection really is key to treatment. And I want to make sure that I am doing my full skin checks for my patients in person. Surgical procedures are not well suited for telehealth. Any malignant or benign skin lesion will still need an in-office treatment to have those taken care of. And then just general treatments for, say, warts or precancerous growths or cysts or things that we actually have to do as an in-person procedure, those are still going to be suited best for in-person evaluations. And then, of course, our potentially concerning cancerous skin lesions or lesions that we cannot define through a clinical photo. I will request those patients to be seen in the office, and I will determine the appropriate time frame depending on what I perceive the lesion may be from the photograph that they send. In my office, I use a tool called the dermatoscope, which really I can't use through the telehealth visit, and oftentimes those patients just need to be seen in the office. If we do determine that a patient that has sent us a photo is not suitable for a telehealth visit, we cancel that telehealth visit, and we instead book them a visit as appropriate in the office. In terms of cosmetic consultations and skincare, these types of telehealth consultations allow patients to express their concerns and expectations of what their goals will be. From there, we are able to partner to develop a comprehensive treatment plan and discuss any estimated pricing associated with any cosmetic procedure that they may be embarking upon. During our cosmetic consultations that are virtual, we try to mimic the same process as we would if they were in our beautiful office space. This helps to establish patient rapport and develop a relationship with our prospective client. We are able to share before and after photos, as well as videos of our state-of-the-art technology, including our offering of luminous lasers. This is important because we like to highlight our best-in-class lasers and treatments that we offer to help differentiate our practice from others in the area. So what we do in the office, again, is what we are going to do and promote when we see these patients through telehealth. The virtual consultation has been a great way to devise a plan and set a time frame to execute it. Oftentimes, patients will come to a cosmetic consultation with the expectation to be treated that day. But we all know that time restraints, pre-treatment requirements, and post-care protocols can make treatment on the day of consultation highly unlikely. By having a virtual consult first, the expectation is set with the patient that this meeting will offer the opportunity to make a plan and then set the steps in motion to get it accomplished. Even without being able to engage our client in our new, beautiful, clean, bright, state-of-the-art facility, we still believe we can show them what makes our practice and our providers the best choice in the area to achieve their aesthetic goals. We achieve that through our hands-on and personal approach with our clients from the first point of contact that they make with our staff through their telehealth consultation, and then with their culmination of their in-person treatment. So through this telehealth platform, we believe that sufficient information can be given to the patient for them to make an informed decision. Just like in the office, we will often discount treatments for new patient consultations if they place a deposit on the day of their virtual consultation. Again, this can be performed from the comfort of their own home at a time, even after hours, that is convenient to them. Sending in high-definition images prior to their consultation can also be a great asset to address their concerns as well and to review them during your call. And as you can see listed, there are a myriad of concerns that we can consult on through telehealth, and I am sure that you have several more that you could add to this list. So just like in the office, we obviously need to bring the patient from the inception to the endpoint. So everything in telehealth takes a little more time and effort and persistence from your team than if the patient was right in front of you. Sometimes it can be more difficult to develop a personal connection via a video conference or email or telephone, but it can be done, and it starts with a great team and great providers. Our entire staff is now a front-facing employee of our business, whereas in the past, some staff members worked more from behind the scenes or on a clinical side. We have trained each team member on all aspects of phone etiquette, scheduling, telehealth processes and protocols, taking patient histories, and even scribing. We want to ensure that our staff is competently trained to work with our clients to ensure they are at ease through the entire process. It is important that my staff work seamlessly to establish rapport so that I can continue to build on that trust during the telehealth call and ultimately keep the patient happy within our practice. As I said, my cosmetic consults mimic everything that an in-person consult would, down to closing the call by booking them with their procedure. We continue to offer promotions or unique package offerings as an incentive and reward for booking straight from the consult. So let's talk about compliance. Telehealth has gradually become a legitimate and accepted form of healthcare. The individual states are largely responsible for laws regulating the use and access to telehealth. Depending on your state, prior to this pandemic, your telehealth laws may have been very restrictive. With the increase in technology usage coupled with physician shortages across the country, telehealth is now viewed as a viable option to treat our patients. With that comes the need for laws, regulations, and industry practices that ensure it is a feasible option from a process, access, reimbursement, and clinical care perspective. These laws, regulation, and industry practice will continue to evolve, but I think the COVID-19 pandemic has opened the eyes of the federal government, the states, and private payers to the power of telehealth. Medical practices should try their best to stay up to date on the laws and regulations as they are rapidly evolving and being enhanced upon. In regards to telehealth, my team has focused on the following. Number one, HIPAA compliance. The most important part of practicing telehealth, regardless of the location, be it in person or virtual, is following your HIPAA laws. Currently, there are some ways in which you can see patients that through modalities that are not HIPAA compliant. We use a platform that is HIPAA compliant with our video conferencing because, again, our patient safety is of the utmost importance. And these regulations have been relaxed due to the COVID-19 pandemic. But in the future, these may change. So we're happy that our provider does give us a platform that is HIPAA compliant. And then again, there are multiple regulations that you need to be aware of prior to providing the service, because there are different entities that participate in terms of payers and regulatory boards and states and governments. So you need to be aware of the rules from your state medical boards, the Centers for Medicare and Medicaid Services, and of course your commercial and private payers. As things rapidly develop regarding what we know about COVID-19, policies around telehealth have also been developing alongside of it. Ensure after this pandemic, you and your team continue to stay current. It is helpful to assign a telehealth point person in your practice. So let's talk about some of our best practices in terms of implementation. So my advice would be to set your practice up for success by doing the following. Find a software solution that works with your existing software, workflow, and patient base. Look for a solution that is in the healthcare provider space, as they are more likely to track changes and adapt to the enhanced requirements, coding, and documentation changes as they occur. If you choose a non-healthcare provider, chances are when regulations change, potentially after the COVID-19 pandemic has ended, you will be looking for another software provider. This may lead to added costs for your practice, additional staff and patient training, as well as potential patient dissatisfaction and interference of workflow. Adequately train your staff on not only the software, but the telehealth process flow. Your team should fully understand the process and steps to get your patient from registration to conveying expectations of the virtual visit, to the patient understanding the portions of the billing and payment that will be done in association with the visit. Be upfront and transparent and ensure the patient understands just because it's virtual, it currently is still treated like as if you were in your office where standard copays, deductibles, and coinsurance would apply, unless, of course, the insurer has made other arrangements. Choose someone in your office to stay up to date on the changing laws and regulations of telehealth. You can have that point person brief your team at team meetings. Be prepared to spend time with your patients to get them up and running on your chosen platform to ensure they are comfortable using it. Be patient as well as we all adjust to the new norm. Be sure to expound upon all the advantages of telehealth. It may take some effort to get some people out of their comfort zone, but do everything you can, especially during this pandemic, to convert your patients to this necessary, safe, and convenient platform. This modality is about keeping everyone safe right now, but certainly could serve as an alternative modality from now on to serve your patients in another capacity. Communicate your telehealth services and the benefits to new and existing patients through email, text messages, your website, Facebook, Instagram, and any other media that you use. So what have we learned in terms of best practices from the virtual visits? Our team tries to ease any fears of this technology well prior to the synchronous video that they have with me. As I said, we treat this interaction with our patients as an opportunity to develop a relationship that sometimes can be more difficult within the walls of a medical facility. We follow a telehealth checklist, which we develop to ensure that the patient is ready for the telehealth visit. We try to walk them through every aspect of the visit, from pre to post requirements, as well as provide instruction and how-to videos. The more prepared we can make them ends up being the more time that I can actually spend on the actual concern and reason for their visit, instead of spending time troubleshooting as the call is initiated. If they enjoy the time-saving convenience of telehealth, they can ask us if this option is available for future appointments. COVID-19 is not going away anytime soon, so it will be important to continue to limit in-office visits for the foreseeable future for the appropriate patients and appointment types, and we are scheduling future appointments now with telehealth. A patient can access telehealth by using a smartphone, tablet, or computer via a patient portal in any private space in which they can access high-speed internet. For our dermatology patients, we do recommend either a smartphone or tablet. We recommend that for a couple of reasons. Typically, the camera on a phone is higher resolution, and it's easier to get that camera into position so that I can clearly see the issue at hand or the spot of concern. It is much more difficult to hold the laptop in the correct position or get that camera into the correct position for me to see the area of interest. Obviously, if a computer is all that's available, that certainly can be used, but we do stress the need for patients to send high-resolution photos prior to the visit. If the area is in a location where somebody cannot reach or get to, of course, they can have their quarantine buddy help take their photo, or somebody else that's available to send that in to us. All high-resolution photos are sent in through HIPAA-secure channels and uploaded to the patient chart. I access the chart prior to the visit for review. And like I said before, in some instances after the photo review, I have canceled the telehealth call and moved the visit to an in-person office visit. Requesting photos be sent in advance saves time and eliminates a telehealth call which may not have been appropriate. This is probably the best requirement we have rolled out, and patients have been receptive to the request from young to old. So how's it actually going? The COVID-19 pandemic has been a very difficult time for medical practices, especially those that rely heavily on cosmetic procedures as a sole source of revenue. Since COVID-19, the amount of patients we have seen via telehealth has continued to increase weekly. As patients adapt to this new normal, they have become more willing to engage in this type of platform to discuss a new concern or request follow-up on a pre-existing condition. In May, we are scheduled to see approximately 40% of our 3-month average number of appointments, which would be from December to February, via telehealth. For small business, which remains closed to in-office patients during this pandemic, this has been a way that we've been able to keep our entire team employed and paid. And telehealth has been a huge success story for us in our practice. And obviously, this has taken a lot of work, and my team has worked seamlessly and tirelessly to help me to execute this platform. Without the revenue from telehealth, it would have put us in a very difficult situation during this time that we had been closed. Our team has been able to communicate every day, complete projects to make us more efficient, and put processes in place that we will continue to use even when we were back seeing patients in the office. Prior to this pandemic, and even more so now, I believe a strong doctor-patient relationship is the foundation for high-quality patient care. My practice will utilize telehealth to support, not replace, traditional in-person provider care. With telehealth, providers can continue to care for patients in person while still providing the flexibility and convenience of seeing patients remotely. This really is a win-win. So I really believe telehealth is here to stay. This platform is really something you should not fear, but rather embrace and incorporate into your workflow, not only now, but for the future. It is unfortunate that it took a pandemic to bring this valuable tool into the mainstream, but let's keep utilizing it and showing everyone what a tremendous resource it is to offer to our patients. Then payers will likely keep the service available to their patients beyond this unprecedented time. Telehealth provides an opportunity for medical and aesthetic practitioners to have increased access to patients, both old and new, an increased revenue stream and decreased overhead. Use telehealth as a discriminator in your practice that sets you apart from your competition. You might even find out that you like it. So that's the end of my presentation. I wanted to thank you for taking your time to join us today on this webinar. I appreciate the opportunity to speak with you, and I will open myself up to questions at this time. I've provided my email address and my website should you need to reach out to me after this webinar. And I'll turn it back over to Kevin. Thank you.
Thanks, Dr. Lambro. That was fantastic. So informative. And, you know, I know in today's world, this is where we're all heading, to this virtual environment. And I think since the beginning of this pandemic till now, we're all just so used to being on screen. And so this has really hit home, I think, for so many of our providers. And we've received a lot of questions. I think the first question that I want to ask you is, you know, you said it's not going away, and next Monday you told me that you're going to be opening up again, hopefully back in your office, seeing patients. What do you think will happen? I mean, obviously telehealth is really here to stay. How will you continue to integrate telehealth into your practice? I mean, will you still continue to obviously do those live consultations and then even do follow-ups via telehealth? Do you see that kind of just kind of changing the way you do things, even becoming more efficient for both you and your staff?
Yes, certainly. I have already booked many follow-ups from patients that I have been seeing with telehealth, and people are very open and receptive to booking their follow-up a month, 2 months, 3 months down the road via telehealth, because they see it as being a very simple way to continue to get the care that they need without having to take time away from the other things that they are doing. And they see the value with this type of healthcare. And like I said, you can provide these types of consultations at times that are convenient for your patients. Oftentimes your cosmetic patients don't want to take time off of work. They want to come in after hours. They want to talk to you on a Saturday. And if you're not there at your office at that time, it's hard to accommodate that request. But now with telehealth, you really can do the visit anywhere that is convenient for the provider and then convenient for the patient. And taking those obstacles of commuting time out of the way is very important for patients. Not having to have a parent pick their child up early from school and take them and have them miss a portion of their school that's important, and have the parent have to take time away from work and then come and sit in the waiting room, and all the steps that take place in seeing you, are simplified when you're able to just, again, call them up on their tablet or their phone and have their visit with them when they're sitting in the parking lot just when they got out of work, as opposed to having to get in the car and fight 20 minutes of traffic and then be late anyways. So it's really something that we're continuing to integrate. We are at this point using it as I'm booking telehealth actually throughout the day in between appointments, so that we can give my staff more time to get in and clean the rooms and be thorough with the turnover. So we're using them actually as appointments that can be buffers between patients. And then when I've had days where it seems that a lot of follow-up telehealth appointments are calling, then I'm just stacking them on top of each other. So then that frees up time for my staff to get caught up on other things, as well as I'm seeing patients virtually.
Fantastic. Now, Obviously, you have many. How many Luminous devices do you currently have? Which devices do you have? I should ask.
So we have the LightShear, we have the Geneo, and the Pico, and the Legend Pro.
You have quite a few Luminous devices, so thank you for that.
We do. Lots of toys. It's great.
Lots of toys. So obviously during the pandemic, aesthetics is that question. People do need those consultations. I'm sure that there's all of this pent-up demand for aesthetics right now. People want to get back into you. We were just talking before the webcast that everybody needs their neurotoxin. How have you been handling these cosmetic consultations for aesthetics? Someone who wants a Pico treatment, maybe for tattoo removal. Talk us a little bit through that, or even laser hair removal. I'm just trying to put it in perspective because, again, most of the time that was done in person. So how would you consult someone virtually?
So like I said, these virtual visits mimic what I do in the office. If I feel that a photo is going to help me to talk to the patient about their concern, then I make sure that they have photos sent prior to that telehealth visit, and then I can put their photos up on the screen, and I can use my pointer, I can use my mouse, and I can say, this is the area of concern, this is how we're going to approach this is what you need to do in preparation. Right now, your skin is too tan, I can't see you for a month anyways. So I put the plan in motion. Maybe you're not the right candidate for the treatment that you thought you wanted, but I have this other tool that we can use. So most of the times when I see patients in consultation, oftentimes it's a conversation and it's not exactly the way that they thought it was going to go because they think that they're going to get the same procedure that their sister got because that seemed to work out for them, but their skin type is different and not appropriate. And maybe they don't understand the amount of treatments that are necessary or the pre-treatment protocol or the time or spacing between treatments or maybe the cost. So again, we can go through this whole, all the information that's needed to make the patient be informed and make an informed decision, and then book the appointment when it is appropriate, when all the things that need to be done prior to that type of procedure have been done. They've taken their antiviral prophylaxis medication. All the things that need to be done, we've checked all the boxes. They come in and they're ready to get it done on the time frame that's appropriate. So these virtual consults really help because a lot of times, like I said, patients come in the door and they think, I need filler and I want it done right now. And sometimes that you just don't have the time to do it. But this lets the patient know what the plan is. And then when they come to the office for their visit, they know they're going to get what they wanted done and be set in motion to reach their goals.
Fantastic. I have some other questions, Dr. Lamoureux, from the audience. What are you doing to market your telehealth services?
So like we mentioned in the presentation, we did e-blasts to all of the patients in our universe. We are active on social media, so we very frequently during this time have been posting that we are available for telehealth visits should there be a need or a new concern or something that they had been hoping to get to the office for but never had the time in the past. We are just making people aware on our website as well. Word of mouth is obviously always helpful. We see people posting on forums in our town and in our community saying, oh, I went to Dr. Lamoureux, I did telehealth, it was really easy. So we're just getting out there through our regular media channels. And then again, our staff, as patients call, they're educating patients as well.
Perfect. I have a question from one of our friends in India. There is a debate in India as to how much to charge for teleconsults, same or some fraction of the in-person consultations. He'd like to know your thoughts.
So thank you for that question. At my practice, I do not charge a fee for consultations. I like to use the time for the patient to interview me. And in turn, I am interviewing them. And we're making sure that our relationship is going to be a good fit going forward to deliver the treatments that they're interested in having, to help them remove their tattoo with the Pico, or help them get rid of that hair under their arms that they don't like with the light shear. So I want to make sure that, again, our personalities are fit and their goals are reasonable for what my either hands or my devices can do. So for me, it is not a question of price and what I'm going to charge my patients, but I think that if it is your commonplace to charge a certain fee, I think it should stay the same. Just because you're doing it virtually doesn't mean that it's not the same amount of time, resources, your expertise. All those things are exactly the same. You're just delivering it through a different means. So I think you should just mimic what you do and not change.
Thank you. I also have another question from our friends in India. How much time do you think is suitable for a typical teleconsult?
So it can certainly depend on the concern, if it's a new patient or a returning patient. So I would say between 15 to 20 minutes is adequate amount of time for me, especially when patients send me photos and follow-ups maybe being 15, new patients being a 20-minute consultation. A lot of times it just depends on the flow of our conversation, and sometimes it can take a little bit longer, obviously, and sometimes it can go more quickly. But that's typically the time frame that I put aside for consultations.
Great. Okay, I have some more questions here from the audience. Tell me a little bit about, have you found that, have you received any resistance from patients about meeting this way? And if so, what did you say to alleviate their concerns?
So thank you for that question. We certainly were facing more resistance in the beginning of our office closure, which was in mid-March. Patients didn't want to embrace the virtual visits. They wanted to just cancel their appointment when we called and told them that our office was not open, or reschedule it for a later date. They weren't interested in doing this telehealth type of visit. But what we started to explain to patients is that this is something that I've actually gone through. I've gone through my schedule. I've gone through their chart. I reviewed their visit notes, and I've said that this is appropriate for me to see them through telehealth. So I think if your staff relays the fact that the provider actually said that you're appropriate for telehealth, that can help to take some of the fear away. Also, you can, again, have your staff be very versed in the platform. Our electronic health provider has some great, easy video tutorials. So those can be helpful to share with patients to, again, ease their fears and to also show them how simple it is. So yes, in the beginning it was a little bit more challenging, but then we found that their primary care doctor was offering telehealth, or their urologist was offering telehealth, and they had already had an appointment with one of them through a video conference, and it was easy. So as time has gone on, we've found week to week that the amount of patients that we're seeing via telehealth has increased dramatically. And then when patients have their visit, they realize how easy it is and how it's just them and I face-to-face having a one-on-one conversation. And it's really comfortable. And I haven't had one visit go bad. So it's just, again, having your staff talk to them, walk them through the process, ease their fears. That's the best thing you can do, is have a trained staff, because you're not picking up the phone and talking to them to book the appointment. You need to have your staff serve as your representative and help parlay any fears and make the patient feel comfortable to book.
And that's what I was going to ask you. So when they're booking the appointment, how are you streamlining this? So if I were to call your office and I wanted to book a telehealth visit, you have your staff members that would take my call and actually book me an appointment. Do you do it through some sort of automated system? Is it through the telehealth system that you're using as far as software to manage all of your appointments virtually? Does it provide ongoing reminders and alerts to the patient? Just trying to get a better sense of that.
Yes, so we use our standard Office suite. We use a software company called Modernizing Medicine, and they have very specific software tailored to dermatologists. And we also use their electronic health record and their practice management software that communicate with one another for all the patient's needs, from billing to scheduling to the visit notes and storage of information. We also use our website provider where patients can continue to request online appointments. So we use Patient Pop, and we will get emails throughout the day and night for patients wanting appointments. And so however the request comes in, my staff responds. They call the patient or respond to them through the media that maybe they reached out to us on, because we find that if patients reach out to us electronically, maybe they don't want to hear from us by phone call. Maybe they just want to get an email or a text back, because that's the way that the modern world operates. So our staff will reach out to them, let them know that, yes, this appointment time is available. We need to, speak with you because you're a new patient. We're going to need your photo identification, your insurance card. These things can be easily photographed and either uploaded right into their patient portal by themselves at home, or they can email these pieces of information through our secure email address that we have that goes directly into the practice. We email them our practice consents. We have them sign them and email them back. We then request the photos as well, and they usually send those within 24 hours of the appointment. So all the paperwork and documentation that we need is typically received electronically. And again, most people have been perfectly fine in being able to accomplish getting all those documents back to us. And then what we have learned from the beginning of this is patients, if you do have to call them, they don't want to get 7 phone calls from your office asking for one thing at a time. Oh, now we need your insurance card. Now we need your copay. What we've learned through this process is try to streamline everything in that first phone call. So gather all the information, gather the information about the visit and why they're coming in, start putting that information into their chart, get their medical history for me, get as much information as you can so that when I go to see them, I have a lot of information about the patient so that I can see them and understand their medical background and then understand their concern appropriately. We have them, my staff collects the copay. They walk them through how to access the telehealth platform, how to download the app on their phone if that's how they're going to speak to us, or how to get in through the patient portal. So again, on one phone call, we've learned to try to spend the appropriate amount of time with the patient to answer all the questions, walk them through the process, and minimize any need to call them back prior to the appointment. And that really helps make the process move smoothly. And then our software company that we use to send out our patient reminders will send out the reminders as they typically will. Typically, phone calls and texts letting them know that their appointment is coming up.
Fantastic. So it sounds like obviously there's a lot of homework you have to do in advance to really prep to be a telehealth provider. But I guess you quickly reacted to the world crisis. So that's fantastic. Just one more question that we have. Tell us about the use of other platforms. I mean, obviously you have your HIPAA compliant teleconference platforms that have already been approved, et cetera. And we totally recommend practitioners follow those. But what about platforms such as Zoom or Microsoft Teams? I just noticed a new one. I got an email on Gmail that there's now Google Meetings that they've just uploaded. Can practitioners use any of those platforms?
Yes. So any platform right now can be used. There's no regulation on the platform having to be HIPAA compliant. That could change in the future, like I said, as we get beyond this pandemic. But right now, in terms of allowing access to any practitioner provider, be it that you have an electronic health record or not, you can document the way that you do and then call the patient through whatever platform is easy to you, be it DoxyMe or Zoom or FaceTime. Skype. Some platforms are probably more secure than others. They don't recommend you call a patient through something like Facebook Live or these other types of streaming sources that could have higher risks of people being able to access the information. But you can use whatever platform, like I mentioned, the Zoom or the DoxyMe or Skype right now, and most of those platforms can be available free of charge. I believe some of them do have HIPAA-compliant versions of their platforms, but that would come at a charge. Luckily, my software company was able to launch the telehealth application within our software when the pandemic began, so we didn't have to use alternative means to speak to our patients, unless, of course, they really have no access, and then we make an alternative way to communicate with them.
Got it. And do patients, once you've done a telehealth consultation or several, do you record those telehealth consultations? And can the patient receive a recording?
So we have not recorded them, but just as I would document as if the patient was in the office in my medical record, in terms of our conversation, their physical findings, my assessment, my plan, they can access their visit note through our patient portal. So they can review the plan and what I've said by logging on through their patient portal. But in terms of the actual recording of the conversation that we've had, no, that's not recorded.
Got it. Okay, well, thank you, Dr. Lamro. This has been extremely informative. We really appreciate your time. Obviously, this is the unknown we're chartering these new waters, and we couldn't be more appreciative of you participating with us today on this topic. And of course, to all of the audience members, feel free to reach out directly to Dr. Lamro at doctor@skinderm.com. And Dr. Lamro has a thriving practice outside Boston, Massachusetts, correct? It's in Shrewsbury, I believe. And
yes.
So if you're in the Massachusetts area, definitely, I'm sure, visit her or stop by and say hello. And Dr. Lamro, thank you again for your continued partnership. And everyone have a wonderful day.
Thank you, Kevin.